Hi, my name is Cindy and I'm a registered nurse. I'm going to talk today about an acute asthma attack and some of the medications that are used to treat asthma. Asthma is an inflammatory disease in which the airways become inflamed, which makes it difficult to get air into the lungs. The airways become narrow and breathing becomes difficult. Currently, there's no cure for asthma. The symptoms are treated with anti-inflammatory medications and bronchodilators. Usually, inhaled corticosteroids are used. The common characteristics of asthma include a barky cough, wheezing, and shortness of breath. Allergens are often the cause of an acute asthma attack. Oral medications can be used to treat asthma as well as inhaled corticosteroids. Medications such as prednisone are also used. Prednisone is an anti-inflammatory medication which decreases the inflammation and makes it easier to breathe. Prednisone is prescribed and should be taken exactly as prescribed, and it should not be stopped abruptly. Normally, people who are taking prednisone, it's tapered off slowly over a period of time. Oftentimes, when there's an acute exacerbation of asthma where medical techs are needed, emergency medical technicians, the primary focus of their medication therapy is to achieve the best lung function as quickly as possible. Medications such as ipratropium, bromide, and epinephrine are used by emergency medical technicians. Epinephrine can be used for bronchodilation in an acute asthma attack. Normally it's given by the subcutaneous method. Some physicians believe that the tachycardia and the increased blood pressure are due to the hypoxia, anxiety, and the actual work of breathing for people who are experiencing an acute asthma attack. These symptoms should improve with relief of the bronchospasm. Epinephrine is also beneficial for people who are not able to hold a nebulizer due to severe bronchospasms and inability to move air. It's important to remember that prior to giving epinephrine that the lungs should be auscultated. It should be listening for air movement in all lobes of the lung. Also, it is important to check the blood pressure and pulse as well as respiration during and after administration of epinephrine. It's a good idea to have them on an electrocardiogram so that heart rate can be monitored and blood pressure should be monitored every 5 to 10 minutes. It's necessary to monitor blood pressure because one of the side effects of epinephrine is an increase of blood pressure, and an increase of arterial blood pressure can cause angina, aortic rupture, as well as cerebral hemorrhaging. It's also important to monitor pulmonary function prior to treatment with epinephrine and after treatment as well. The use of spirometry will help determine any decrease in expiratory flow rates. After the patient stabilized with medications, it's important to obtain a family and personal history of any allergies or any other illnesses that could have caused a spike in the symptoms to cause the acute asthma attack. Nowadays, epinephrine has been replaced with nebulizer beta agonists as first-line treatment for acute asthma attacks. It's become the mainstay of treatment in some hospitals, and in these hospitals, it has also become a nurse-initiated protocol where nurses are able to initiate these nebulizer treatments prior to getting a physician's order. They're followed by a physician as well. Thank you very much for watching.